welcome to National Concussion Awareness Day. I'm Katie Pierce, physical therapist in Flagstaff, Arizona, and Brain Injury Alliance board member. I'd like to talk with you about concussion and autonomic nervous system dysfunction. In other words, what I wish people knew after concussion. Like I said, I'm on the Brain Injury Alliance of Arizona. Its mission and vision are near and dear to my heart as both a survivor of multiple concussions and as a physical therapist who works with people with brain injury. I'd like to thank Core Balance Therapy. It's who I work for in Flagstaff, Arizona. And Complete Concussion Management is an organization that I've recently been certified with as a post-concussive rehab provider. What a lot of people don't know after concussion is that autonomic nervous system dysfunction, which is called dysautonomia, can be a driving reason why symptoms persist past the normal 1 to 3 month recovery time. You may ask, what is the autonomic nervous system? The autonomic nervous system is our automatic nervous system. It takes care of things that are non-conscious, like breathing, pupil size, blinking, heart rate, blood pressure management, bowel and bladder function, and even the entire digestive process. After a concussion in some individuals, some or all of these components of the autonomic nervous system can become out of whack. The big issue is that a lot of healthcare providers and individuals don't know or don't talk about autonomic nervous system dysfunction after concussion. I ended up learning simultaneously, both professionally and personally, about autonomic nervous system dysfunction, and I'm going to tell you a little bit of my story. First, here's the doctor with a question mark. What's going on? This represents me in physical therapy school. For 4 years of PT school, I never learned about autonomic nervous system dysfunction after concussion, including a specialty training for 8 weeks in a post-concussive clinic. Then, right in the middle of that specialty training that I had, I fortunately, or actually unfortunately, had to learn about autonomic nervous system dysfunction and concussion firsthand. I was in Portland, Oregon, and yes, I was about 25 feet away from a sign just like this and crashed my bicycle. I had had 1 concussion in my first year of physical therapy school, and this was less than 2 years later. I had a second and more significant injury. At first, I had post-concussive symptoms that were typical, although quite severe. That lasted a few weeks. Then those symptoms lasted a few months, and the symptoms lasted multiple years. Slowly, these symptoms, instead of getting better, started to worsen. I was left with intense headaches, diagnosed as daily migraine. I experienced dizziness and balance problems, and I experienced a near fainting feeling, a very lightheadedness, if I was standing up for anything longer than, let's say, about 3 minutes. I also was dealing with a crushing fatigue. You often hear about fatigue after concussion. This was, say, maybe 5-6 years after the concussion, and this fatigue was so severe that I would need to crawl up the stairs at home when I got home from my 4-hour work shift and get into bed as quickly as I could, because if I didn't lie flat quickly, I could have blackouts, partial paralysis in my hands and face, or even a seizure. And that's my poor husband trying to figure out how to help me during a seizure. During this time, I saw nearly 20 healthcare providers, and neither myself nor my healthcare providers were aware of autonomic nervous system dysfunction. No one mentioned that to me in these 7 long years after my injury. Fortunately, in the very end of 2016, a local healthcare provider in Flagstaff came to the clinic where I was working, and I'm still working, Core Balance Therapy, and she spoke with us about providing physical therapy to people who had autonomic nervous system dysfunction. And here I am watching this presentation, and she's talking about something called POTS that I'd never heard of. Postural orthostatic tachycardia syndrome is a type of dysautonomia that can be triggered by a virus, by a severe vaccine reaction, by an injury, and then she said by concussion. She described the symptoms of POTS as widespread autonomic nervous system dysfunction, difficulty with digestion, difficulty with headaches, dizziness, imbalance, and even these anoxic episodes. And anoxic means lack of oxygen, so lack of blood flow to the brain. And this presenter said that people with dysautonomia could even have seizures from anoxic episodes. So here I am in the audience and I'm thinking, oh my gosh, this woman is describing my life. Actually, I didn't think that at the time. I was just thinking about my patients who would need help in this area. And it was that night that I sat bolt upright in bed and thought, I need to talk to this person. I ended up emailing the presenter, and Teresa Dowell, who is a specialist in chronic fatigue syndrome and POTS and other forms of dysautonomia, got right back to me, and she became my healthcare provider. On this slide, you can see someone sitting is getting plenty of blood flow to their head, and then this graphic shows that the blood isn't quite reaching the brain. The idea with POTS is that when lying down or sitting, it's easier for the heart to pump that blood and oxygen up to the brain. And within one visit, Teresa had diagnosed me with POTS by doing a simple lying down to stand test. And in all the healthcare providers I had seen, no one had had me lie down and take my blood pressure and then stand up for a prolonged period of time and see what happened to my heart rate. And with POTS, what happens is as the person stands longer, the heart rate goes up and continues to go up, and there's a rise of over 30 beats per minute from lying down to standing up. And that's how she diagnosed POTS. Teresa prescribed medication for me to help control blood pressure and help control heart rate, and all sorts of other symptoms like anxiety ended up essentially resolving as well. Turns out when you get enough blood flow to the brain, it's a little easier to be relaxed. Managing dysautonomia, it's usually a lifelong condition. However, some people can go completely into remission, and I'm grateful to say that for about a year now, I've had very few symptoms of POTS. It's managed with a special exercise program involving cardiovascular and strength training. Lots of fluid and salt helps keep symptoms at bay, and some people will use medications like I did temporarily to help the symptoms. Now, if you or a loved one have ongoing symptoms that are actually worsening after a concussion rather than getting better, you might want to think about dysautonomia. Why? Because it's very easy to test for. It's just not commonly thought of or talked about. If you need help for yourself or a family member or friend after a concussion and think you may be dealing with dysautonomia, I recommend learning more at dysautonomiainternational.org. I've been to a Dysautonomia International conference. It was phenomenal. You can start by talking with your primary healthcare provider. Mention that you've had a concussion and that you're concerned about symptoms of autonomic nervous system dysfunction. Of course, the Brain Injury Alliance of Arizona is also here for you. We have resource facilitators who can send you to a post-concussive rehabilitation specialist. And these days, anyone who has a post-concussive specialty behind their name should be familiar with dysautonomia and concussion. And finally, here's a little treatment fact sheet from a PhD student who was working on POTS that I really like. She talks about conventional medical ways to manage POTS and then alternative ways as well. If you're interested in more academic reading, feel free to check out these articles that I have links to here. Thank you for your attention, and we hope this information was helpful.